Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm very excited today because I'm sitting down with Dr. Rajeev Agarwal, and he's going to be speaking at our upcoming Tongue Tie Symposium. Now, Rajeev, welcome back to Gold. It is so good to have you here today. There's definitely some buzz and excitement happening in the field right now. Always a little bit of controversy, lots of research going on, but how are you doing, my friend?
Priya, I am doing amazing and I am just so excited and happy to be here. There is a lot going on. I totally agree with you. There's a lot of controversy. There's a lot of good work that is happening, but you're making slow progress. Progress, nevertheless, and it's going in the right direction. So I'm very happy to share my experience, to kind of speak to the audience and get the questions. So this is a good ground for some good work happening.
That's right. Absolutely. Now, for all of you listening in right now, head over to our tongue tie website and you'll be able to lock in this presentation because it is free to everybody. So, did you hear that? Say it again. It is free to everybody, which means there's no excuses whatsoever to be able to come and listen to Dr. Argawal. Now, tell me, Rajiv, you've been doing this a hot minute. We were just talking offline. You said to me, 32,500 phrenolomies, top and bottom. It's a lot. I know that you have some immense experience, but you will share too that there is still this learning curve that's happening. Tell me, what first led you to focus on this so deeply? Like what grabbed your attention in this arena that has taken you on this journey?
Fiona, you should remember to ask me this question because the answer is going to be long. I'll make it short. Okay.
Okay, okay.
So I'm a pediatrician. I'm a general pediatrician. I'm trained in I'm a pediatric nephrologist, as some of you may know. So I have that I'm looking for patterns. I'm looking for specialties to, like, how do we do to make things better. So I'll tell you, this happened about, I don't know, 17 years back, I guess, when there was a mom who came to my practice, general practice, and she said she wanted to breastfeed. And I said, so go on and do it. I mean, why are you asking me? I'm just a pediatrician, right? She said, my child has a tongue tie and you're going to take care of it. And I said, oh, I don't think so. That's not what I'm trained. That's not the AAP statement or anything. Nothing. I'm not going to do it. And she had tears in her eyes.
Hmm.
And she told me about her journey as to how she had been able to have this child and what it meant to her, what breastfeeding meant to her. Of course, she brought tears to my eyes, and my heart was just like, I can't explain it. I wanted to help. This child has an obvious tongue tie. I did the examination. The baby's tongue was not moving. But I will tell you, I had a lot of trepidation. I had a lot of fear, a lot of fear. There was no organization those days. There was nobody I could call. Okay.
Hmm.
Now I had done some procedures in my med school days, some random procedures in my med school days, tongue ties. But the training was, it doesn't help. Don't do it. It's not required. It's not recommended. But I said I owe something to this mom, to this
Mm.
child, to my discipline of general pediatrics as a pediatrician. We all know how wonderful breastfeeding is. So why am I not going to take the next step to make this happen for this family? That is what's most important. So anyway, I did my reading. I asked her to come back next day, and I was very fretful, very worried. I wrote a disclosure this long. Uh, I was just very worried.
Mm.
Um, Next day, I thought she wouldn't come, and I made her sign things like, your child might die. There may be so much bleeding. I was so scared. I wanted to just cover my bases. I did the procedure. This procedure went well. And 2 minutes later, the mom came out of the room crying again. I was like, oh my God, what did I do? This time the mom came out crying because the baby was gulping at her breast.
Oh,
The
yeah.
baby was happy. The mom was, I couldn't stop her tears. She was just like, this is what I wanted. This is what I have wanted for this long. Now I feel like a complete mother.
Mm.
And there are moments in time when you feel like You look at your journey. I've been a pediatrician already 15 years when this happened to me. 15 years. And I'm like, how many moms have I not supported?
Right.
How many moms I could have given this moment of motherhood to? I never asked. I never asked. This mom demanded this of me. She demanded, and I provided.
Amazing.
And then what happened is over, mom obviously, as you can see, she was very focused, and she said, you're going to help other mothers.
Right.
She went, at that time, social media was just coming out maybe a little bit. She called the IBCLCs. She said, hey, this man's doing tongue ties. Before long, I knew I had people calling me and asking me about tongue ties, and I was still scared.
Hmm.
It took me time. I connected with the community. There were some people out in the community, some people who I still consider my mentors, wonderful people who helped me and told me this is not so much out there. And
Right.
then I did a lot of reading, a lot of like looking at the mechanics of the mouth. And over the years, it's been years and years. And I will tell you, it's been 15, 17 years, something like that, a long time, long time. However, I am still learning. Every day, every patient, every family, I am learning. And I think that's the joy of it. I have been asked, you do so much of it, don't you get bored? And I'm like, oh my Lord, no. I enjoy it and I'm learning every time. So
Right.
here I am, I'll be happy to share my experiences. I'm very excited about this opportunity. Thank you so much.
Oh, no, of course. And I think that, it speaks volume to, sometimes we look at people like your stature of, been in the field for a significant amount of time. We won't age you because, I'm sure 30s. Uh, but, the truth of the matter is you can tell a good practitioner when they say that I'm still learning, because the truth is that, we'll probably never be caught up in our lifetime because things are always evolving. And we're always seeing newer things, and we are, for those little ones, those families, they're also individual, which really leads me to my next question, because there's been a lot of conversation about the readiness of families. When are they ready? Do we wait for them to be ready? Do we just push them along, or how do we deal with them? So really my question is, parents often feel so anxious and overwhelmed when faced with the possibility of a frenectomy. They find out that, this is something, and that they have to, quickly learn what's happening, and they're desperate. What do you see the most important factors in deciding when a baby and a family are ready for this procedure? Because is there a factor that plays into that? Would you turn a family away, for example, if you thought that they weren't ready? How do we measure this?
Wow. Amazing, amazing question. Amazing question. I will tell you, Fiona, I believe family readiness is probably the number one determinant of the success of my procedure. If the family is not ready, it is not going to work out. I tell families, I work with you.
Mm,
I don't work against you. I'm not ahead of you. I'm not behind you. Tell me where you are.
right.
First of all, why do you want to do it? And next is, what do you know about this?
Mhm.
As you just said, it is not easy to know that your baby, first of all, there's something wrong with your baby. Yesterday, I had this long conversation with his father who said, you're telling me something wrong with my baby? And I said, absolutely not. There is nothing wrong with your baby. Your baby is having a slight difficulty in feeding, and maybe we can help them. And that kind of, you know,
Yeah.
made them feel better. So to know that their baby is going to may possibly need a procedure, that is not easy. It's not easy at all. At that time, mom is going through hormonal changes. Baby is probably jaundiced. Baby has lost a lot of weight. There's a lot going on. If this is even the second or the third child, the whole family system, the family dynamics have changed. Unless we address all of this, Unless we address all of this, it is not going to work as well. Is there an IBCLC involved? Does this mom want to do it because she read it on social media? Hey, your baby's going to have trouble in the future. Get it done now. And the mom is just like, she wants to do the best for her child. And
Mhm.
she just wants to get it done now because she doesn't want to be told later on, oh, you should have done it earlier. Is that the
Right.
reason she's doing it? Have we even evaluated lactation? I tell parents I do it for a very focused reason of lactation at this age. We are only talking about breastfeeding or bottle feeding at this point. There's the reason why I'm doing it is I'm trying to help you with this. If you bring in other reasons, we will consider that later, if and when those reasons arise. So let's bring it down, first of all, to your concern. Is there a concern about breastfeeding? That's the main question. Will I tell people I'm not going to do the procedure? Yes. Yes. In fact, I get more reviews about not doing the procedure than doing the procedure. Because they're like, you are refusing to do a procedure, my baby, that might help. I'm saying no, as I say no, I'm not refusing to do a procedure that might help. I'm trying to tell you that you and I, we both want this procedure to help. Why are we doing it? What are we gonna need help for? And what do we need to do to make it successful? Once you're ready, you understand. You understand that this may or may not help. And the whole 9 yards, there's many variations to it. There's many presentations. I will tell them, give them realistic expectations. Do they have the family support? Does mom have milk supply? Do I need to work on the milk supply? Is the baby so far down on weight that the baby is not even gonna go onto the breast? Do you see what I'm saying? There's many reasons, Fiona, that I would say, I think we need to I will tell them, I think you need an IBCLC more than you need me. Once things are situated, once we have you situated, meaning you're feeling empowered. You should not feel like your power has been taken away by this physician who does a procedure. No, we work together. We are empowered to make this decision. We make this decision. We talk. I think that is what makes the procedure successful. That's what truly in a relationship, right? I'm going to help you with this. This may or may not help, and I give them numbers with my experience. And then they can choose. And if it's not good enough for them, I don't give them the guilt of not going through it. I say, I support you in not doing the procedure also, because I support you. If you change your mind, you think I can help you, please come back. And sometimes they do and sometimes they don't. And I'm happy either which way. I want them to feel supported, empowered, and hopefully the breastfeeding to go on well, which after the procedure usually does. So that's really good.
Yeah, no, that's wonderful. And I think what I heard you say is it really is about building that relationship with the family and making sure that they have the knowledge. One of the things we were talking about today is that, fear comes in many different, places in our lives, but fear when you have a newborn is real. But that fear that fear is usually without knowledge. When you have knowledge, it dissipates. So, thank you so much. Your work by far, we've seen such a growth in it. And I know during your presentation, you're going to be sharing not just parts of what you shared here today, but also really into the importance of pre and post frenectomy care. You've got some incredible videos to share, and I'm just giving people little snippets, but it is an absolutely fabulous presentation. I'm excited for you to be here. One thing that you really are passionate about, to share with our folks listening in right now, what's some of the things that are happening in the post-care world right now? What do you think has changed over the years, Rajeev, when it comes to, that post-care that we all talk a lot about, right?
So, yes, everybody is scared of post-care. What I tell parents is don't be scared of it. It's truly very easy. It's very simple. People multiply in their head, and that is normal. You have a little baby, baby's going to cry. Moms don't like for the babies to cry. Dads don't like it either, but moms especially don't like babies to cry. And they know, they're like, I don't want my baby in pain.
Yeah.
And you said, what has changed? So the American Academy of Pediatrics is saying they don't recommend post-care. So I usually follow the AAP pretty well. However, here I like to go have a different opinion. About, I would say 7-8 years back, we didn't do post-care, and some babies did not reattach and some babies did.
Right.
Now I suggest post-care, and still now more babies don't reattach.
Right.
And some babies still do. So what I tell parents is the post-care decreases the rate or the incidence of reattachment.
Mm-hmm.
Now, reattachment, again, if I may have just 30 seconds of time of talking about reattachment. Reattachment is a scary word to parents. It's very scary. That does not mean it needs to be done again. The
Right.
body is going to make the frenulum again. If the function is good, you don't need the procedure again. What we're trying to do is keep the function, movement, and function good. So tongue is moving better and is able to reach up to the palate. It reaches up to the palate, it's going to function better. So even if the frenulum is still there, so minimal reattachment truly means it's healing. It's normal. Okay.
Yes.
So I don't think parents need to be all worried about it. Because of my experience, I do suggest post-frenectomy exercises. I really do, and I think they make a difference. But I really don't think they need to be made such a big deal in which the parents are really get so nervous about it. I think it be done in a very playful, happy manner, looking at the baby's cues, looking at mommy's cues, and just make it a nice, happy thing rather than something that they dread. Pain control may have to be done for the first couple of three days, but almost never more than that. So it's as long as you tell them how to navigate this,
Right.
what's going to happen.
Yeah.
They're like, oh, so it's really not that bad. I'm like, yes. And of course, call us. Their questions, call us.
Yeah.
If they have this then they can call you back. They can have a follow-up. They can talk to somebody, or they can have information. They feel empowered. They're like, I can do it. I can do it.
Yeah.
And then and they can do it. And they can do it. They really can.
Excellent. Yeah. Well, that's what we want to hear. And that's what we want to give to our families, is to continue to empower them to make that informed decision. So appreciate the time that you've taken with me today just to answer a few of my questions. I'm excited. We're going to have so much more time when we get back together for our live presentation, of course. That will be September 15th. So if you are available on the September 15th, I highly recommend that you come and join myself, Dr. Rajeev, as well, as we will be taking a deep dive into from evaluation to aftercare, a pediatrician's perspective on tongue-tie care. That is September 15th. Head over to the website to goldtonguetie.com, and you'll be able to register for this event today. And of course, it will be recorded for your convenience. So that's a wonderful opportunity as well. You will be able to listen to the recording too. Thank you so much to Dr. Rajeev Agarwal for being with us here today. And of course, to all of our viewers around the world. We'll see you all soon. Bye-bye for now.
Thank you so much. I'm so excited, and we'll have a great time doing it. Thank you. Bye-bye.
Thank you, Rajeev. Bye-bye.
Bye-bye.